Hi, I'm Gregory Gebo II, and this is a public service announcement about trichomoniasis, also known as trich. Trich is a very common STI and is caused by the parasite Trichomonas vaginalis. The parasite is transmitted from an infected person to an uninfected person during sex. The urethra is the most common area men contract the infection. Females are commonly infected in the areas of the lower genital tract, the vulva, the vagina, the cervix, and the urethra. It is not common for other areas such as the hands, mouth, or anus to become infected. Men with trich most commonly experience itching or irritation inside of the penis, burning during or after urination and ejaculation, and can also experience a discharge from the tip of the penis. Females often experience itching or burning of the genitals, painful urination, and a change in vaginal discharge. Common changes are a greater volume of a thinner, discolored discharge that has a disturbing or fishy odor. Less than 30% of those infected with trich will develop symptoms. Symptoms often develop within the first month after infection has occurred, but there are instances where symptoms do not develop until much later. Symptoms tend to come and go throughout the infection. Older people and those with compromised immune systems are more likely to develop symptoms. Here are some statistics of trich. The CDC estimates that about 3.7 million Americans are currently infected. The infection is more common in women than in men, and older women are more likely to be infected than younger women. Trich is more common in developing countries than developed countries. How is trich diagnosed? Unlike other STIs, trich cannot be diagnosed by the symptoms alone. In order to properly diagnose trich, a person must go to their doctor so a physical examination can be performed. Laboratory tests are also needed for proper diagnosis. Pap smears are not considered to be diagnostic because they have been known to produce false negatives. At this point, you might be thinking to yourself, well, I sure as heck don't want this disease, and I don't blame you. It sounds awful. Let me tell you how to protect yourself. The only true way to prevent trich is to practice abstinence. But if you do choose to have sex, make sure you wrap it up. However, the parasite can infect areas that are not covered by the condom, so this method is not 100% effective. If you do happen to become infected, don't worry, it's curable. Trich is most commonly treated with oral antibiotics. The antibiotics take about 7 days to fully fight the infection. It is recommended that you do not have sex for at least a week after the completion of the antibiotics to ensure no symptoms return and there is no lasting infection. About 1 in every 5 people are reinfected within 3 months of receiving treatment. Here are some fun facts about trich. Feel free to bring them up at your next dinner party. According to the CDC, trich is the most curable STD. Pregnant women can be infected with trich and can pass it along to their babies. The babies are often born prematurely and of low birth weight. People who are infected with trich are more susceptible to other STIs such as HIV. And also, this is not a fatal disease.